Hey, deserving listeners, someone sent me this video of Dr. Mike talking about narcissism and wanted me to react to it. Let's do it. My name is Dr. Kirk Honda. I'm a therapist and a professor. Let's watch.
Yeah. And I related to that a lot because when I first started doing Instagram like 5 years ago, I was a huge narcissist and I didn't grow up being a narcissist. It made me that for that time period because I would go around showing people how many followers I had, how many likes I got, just like everything you talked about. It starts becoming an addictive process. And
well,
just
narcissists aren't born, they're made.
Okay, I mean, that's yes.
For the most part.
There's definitely a genetic component.
Okay, so the debate around nature versus nurture has always been present. And what are we talking about when we say a narcissist? So they're using the term, is a narcissist born or is a narcissist made? Well, first we have to define what is a narcissist, which I find the internet has a lot of different definitions of. For some people, it's someone that posts pictures of themselves on social media a lot. For another person, it's someone who is self-centered and maybe has trouble with empathy. Another person, they define it as someone who likes to achieve things and brag about things. So in the clinical world, we have this narcissistic personality disorder, and it's on a spectrum. And usually that's what when I say the word narcissism, I'm referring to that spectrum. And there's some overlap with what the internet talks about, but not entirely. So with narcissistic personality disorder, there seems to be at least some genetic component, but it's largely created in early childhood experiences. It's hard to know that for sure because we're talking about personality. One, it's hard to determine if someone actually has narcissistic personality disorder or not. You present someone who is a candidate for narcissistic personality disorder to 10 different psychologists who will assess that person, and you will get different answers. You know, maybe 9 will agree that they have it, or maybe 5 will agree that they have it, and the other 5 will not. So even someone having the disorder or not is debatable. And then once we do establish that someone has it, how do we know exactly where it came from and how do we determine that? It's actually pretty difficult to determine because personality is a very squishy thing.
It's entirely how you were raised as opposed to being born. And that's the difference between psychopathy and sociopathy too, is one is born and one is raised.
Sure. Yeah, I mean, look, I
Okay, so she is bringing up the psychopathy versus sociopathy. In the clinical world, we don't tend to use the term sociopathy. Some clinicians will, some researchers will, but the vast majority use the terms either antisocial personality disorder or psychopathic personality. And there seems to be an obsession along the lay public around the word sociopathy. When you hear people refer to others, oh, that person's a sociopath, oh, that person's a sociopath. In the clinical world, we do not use that term, again, for the most part. So I just want to point that out. And I did a whole deep dive on psychopathy versus sociopathy. You can listen to that episode. It's an audio episode. And I go into the literature and all the different ambiguities about it. But for some people, they will say sociopathy and psychopathy are the same. And other people will say, well, they're different. You know, a psychopath is born and a sociopath is created. Again, how do we know that for sure? Someone comes into our office, we assess them. How can we determine, do we give them a blood test and say, oh, you were born a psychopath, oh, you were created? It's all conceptualization. It's all based on someone's opinion, based on interview and how they see the world.
They sound incredibly similar, and when you're talking in common tongue, you're just saying narcissist, right? You're not defining them. But in reality, there's a small but very important difference between the two. So you can have a narcissistic personality trait and be totally fine.
Which almost everybody does.
And have success and this and that. To a degree. Everyone has it to some sort of degree, I guess you can say. But then if you have a disorder, that means it's gotten so bad that it's affecting major aspects of your life functions. Right. We're talking about work, your ability to sustain a job.
Yes, 2 thumbs up to Dr. Mike for this. I've never actually watched one of his videos fully. I've maybe watched little bits and pieces, so I wasn't sure what I was going to see, but I'm quite proud of him in this moment that he is pointing out something that I talk about all the time. On the internet, there's a lot of talk about narcissistic personality disorder, a lot of talk about he's a narcissist, you know, this person is a narcissist. And you're free to label someone as quote-unquote narcissistic in a non-clinical way, in the same way that you can label someone as being mean or a jerk face or someone who is stuck up on themselves or someone who doesn't seem to care about other people's feelings. You can use those labels because it's your own judgment. You're just observing someone else's behavior and making a judgment call. But to diagnose someone or to suppose that someone has narcissistic personality disorder, one, you have to demonstrate that you understand the disorder, which is actually a very difficult disorder to understand. Research shows that a lot of clinicians, I can't remember the exact number, something like 50%, if I remember right, 50% of clinicians don't understand narcissistic personality disorder sufficiently to diagnose it. So even among clinicians, it is rare, or at least somewhat rare, to understand it fully enough to diagnose it properly. And thus, the lay public certainly doesn't understand it as well. Now, there are certain lay individuals who will absolutely understand narcissistic personality disorder because they've studied it a lot, or they knew someone in their life, or they might have it themselves, or something like that. So it's not like everyone in the lay public doesn't understand it. But anyway, the point is that there's a lot of talk about narcissistic personality disorder. I see claims that, oh, she posts a lot of things on Instagram. She has narcissistic personality disorder. And you're just like, what? No, well, maybe, but not based on that piece of information. Society and the internet seems to just be using narcissist as a label to basically ridicule someone or to judge someone. And so we just want to be careful about using clinical labels when we don't really understand them. And so he's pointing out this very astute point, which is in order for someone to have narcissistic personality disorder, they have to have a lot of problems in their life. And typically people, and I talk about this all the time, that people with psychopathy, people with antisocial personality disorder, the sort of things that labels that people will throw out there on the internet, for someone to actually suffer from that disorder, and I use the word suffer specifically because they are suffering. For people to suffer from those disorders, their lives are usually in shambles. Their lives are usually total train wrecks because of their disorder. So I think that's the point that Dr. Mike is making, and 2 thumbs up to that.
Stay in a relationship, achieve happiness in your life and well-being, creating a lot of anxiety, depression, that sort of thing.
Right.
So there's people that are raging narcissists and exhibit narcissistic personality traits who are very successful and don't have the disorder.
Right.
But when I watch some of these videos, everyone's very quick to throw out these terms because they're using them in plain English. But from a medical side, it's a little inaccurate and a little bit disingenuous because people are getting labeled too soon. The idea of mental...
Yes, absolutely. If, as I said earlier, if you want to label someone as like, I don't like that person because they're so stuck on themselves, or they're self-centered, or they're a jerk face, or they're mean, or they don't listen to other people's feelings, or they don't respect other people's boundaries very much. You can say that. That's fine. And those are pretty strong accusations and might fully encapsulate the experience you have with that person. But to label them with a psychological disorder is something that a lot of people are doing these days. I'm trying to remember if we did it 20, 30 years ago as much as we do it today. Maybe we did, but I don't think so. I think people are doing it a lot these days, and it's become normalized. And we have to be careful about that because actually what's happening, I'm seeing in some of my students and my trainees, is with all the talk on the internet, they believe, because when you're a student and you're a novice clinician, you learn from your professors, you might go to the internet to learn some things. And so I'm having to almost deprogram my students sometimes on ideas that they've been programmed from the internet. So students are not coming to me with blank slates. They're coming to me with a lot of jumbled information, some of it good, some of it bad, and I'm having to recorrect for that. So there's a chance that we might have a generation of novice clinicians who have a lot of misinformation rattling around in their heads because of the misinformation that's on the internet.
Mental health and the whole concept of mental health is so complicated and confounded. Even when you're talking about sociopaths, right? That was a big subject on your video.
Yeah.
So sociopaths. In medicine, we don't even have the term sociopath. We have antisocial personality disorder, right? You studied that.
Yeah.
And when
Right, 2 thumbs up to that as well. We don't, like I said, we sometimes in the literature, they will refer to sociopathy, but not typically. What we're talking about typically is antisocial personality disorder or psychopathic personality.
So they could be showing sociopathic tendencies and not be a sociopath. And again, very small difference, but very important.
Right.
Because it's very easy to get labeled something and have that label stuck with you incorrectly your entire life. And
I think it's also
unfairly.
important to not try to diagnose people, A, if you're not a doctor, and B, if you've never met that person. Like, you can't look at somebody's YouTube videos and say what they are and what they're not.
We need to highlight
dangerous.
that. So
yes, I will highlight the fact that Dr. Mike is highlighting that. On the internet, just constant, that person's, I did a whole episode, answering the question, is Logan Paul a sociopath? and specifically, is he a psychopath? Does he suffer from antisocial personality disorder? You can listen to that. That's an audio-only episode as well. And I go through all of the different discussions around that. Long story short, there's no way to know from a YouTube video. There's no way to know from someone's public persona as to whether or not they suffer from a personality disorder. When I diagnose someone with a personality disorder, it typically takes me 5, 10, maybe 20, 30, 40 sessions before I can feel confident in my diagnosis or my conceptualization of someone. Personality disorders are very, very complex, and you can't just tick boxes off and say, okay, there they have it. And I know some clinicians actually will do that, which is irresponsible.
Maybe. But in general, no one's there to harm you with your friends. But people that have social anxiety create an anxiety. Their mind creates this anxiety. And it doesn't mean that there's something wrong with them. Their mind is protecting them by causing them to worry about that social anxiety instead of their repressed emotions. Because those seem to be so dangerous that let's have them worry about something not so dangerous instead.
Okay, so I'm not actually sure what Dr. Mike, his specialty is in, but he's getting into psychology. I thought Dr. Mike was more of a medical professional, but he's getting into some psychological ideas. Doesn't mean that he doesn't know about these things, but he's saying that someone with social anxiety, maybe the problem is that they have these repressed traumas, and it's causing the social anxiety as a manifestation of that. And that is kind of an old, outmoded idea. I've actually seen that before, but it's not usually the case. Social anxiety is usually because of traumas regarding social life. You are bullied, or you're made fun of, or you're humiliated. And every time you interact, even when you're a kid and with other kids, you feel this fear, which causes you to be awkward, and then people make fun of you, and it just creates this vicious cycle. And by the time you're 35, you're terrified leaving the house. So we don't have to look towards Freudian ideas to explain those usually. But certainly that can be the case. But anyway, that's what he's saying.
It also does the same thing from a physical aspect. Let's have this person have a muscle spasm and have some back pain right now.
Oh, wow.
And they'll be thinking about their back pain, how to treat it, what doctor to see. They'll complain about it, and they won't be thinking about their repressed emotions.
Okay, that actually I have seen, where people have traumas that they are repressing, or traumas that they're avoiding for good reasons, or stress in their life, or ongoing relationship problems, and it will manifest physically. It's very, very frequent, and he's pointing out research, and I've read that research as well. Back pain is a frequent symptom of stress or childhood trauma or distress being spiked because of PTSD. It doesn't mean that we always necessarily know that for sure. How do we know? Someone comes in for back pain, and we do all the tests, and we find we can't detect anything functionally wrong that it would be explaining why they would be having such intense back pain. Then they go into therapy, and they start talking about their traumas, they start recovering, and the back pain goes away. Does that mean that the back pain was created by the trauma, or did it just coincidentally go away once they went to therapy? It's hard to know. There's no way for us to know that because we don't have the technologies to measure that yet. But there seems to be pretty strong evidence that, because there's enough people who have that experiences when we actually will do the research, to point towards our body manifesting things that are psychologically difficult for us, for sure. So yeah, I agree with what he's saying there.
So what I started doing
you
in
think
my
repressed
practice,
emotions cause muscle spasms?
Yeah, absolutely.
Whoa.
Not just muscle spasms. There's been research done on this that some of these repressed emotions can go into the form of acid reflux, chronic cough, so many unique things.
These are all my issues.
Allergies, rashes.
I feel like I'm reading WebMD right now.
No. Again, I'm not.
So, right. So, there's two things I'll say. One is that, yes, lots of research going into a lot of the things that we suffer, chronic fatigue, for example. Now, what the flip side of that is that a lot of people with these problems, chronic cough, chronic fatigue, back pain, they go into the physician, medical doctor will do a lot of tests. They don't see anything wrong with you, and they'll just say, oh, it's all in your mind. And that will be very distressing to people. on one hand, it can be a way of just shooing someone away because they're afraid that they don't have the ability to detect or treat the person and they're insecure. And so they'll essentially just blame the victim. Oh, it's all in your head. You're doing this to yourself. And they'll just cause the patient to go away. So certainly that can happen. The other situation is that it legitimately could be stress related and the physician is actually trying to help the patient by saying, it could be stress or anxiety related or trauma related. Have you thought about talking to a therapist? And then the patient, because of stigma in our society, they will consider that to be an insult. They'll be like, what do you say? It's all in my head, or you think you call me crazy? So both of those things can be true.
Stretching, icing, that sort of thing for physical pain. And then it doesn't work, or the pain fluctuates, and I see that it has a very unique history to it where the person keeps getting these aches and pains. I bring them in and I just have a conversation with them. And it's a simple conversation about what's going on in your life, what was childhood like. It's not very in detail initially.
Right.
And what people do and what they've learned to do is they repress their emotions incredibly in ways that will surprise you. For example,
so 2 thumbs up to Dr. Mike in this area as well. And a lot of physicians are starting to do this more and more. In the past, there was hardly any of this, but they're training physicians to do this more and more, which is fantastic to me in my field. Because a lot of people, when they have traumas and psychological issues, they will not go to a therapist like me. They will go to their physician and ask for help. And so it is really important that the physician know how to screen people so that they can not only identify individuals who need to go to a therapist, but also how to talk with them to convince them to go because there's so much stigma around it. So Dr. Mike is talking about that. He's saying, okay, I first, when we have a problem, I assess the most dangerous things. And if that doesn't show anything, then I start working down the line to figure out if we can find some physical problem that would explain the complaint that the patient is having. If all of those things are ruled out, then I bring him in and I say, hey, how are things going? How was your childhood? We don't, he's saying, I don't go into it a lot because I'm guessing that's not his role, but just trying to broach the topic a little bit, have some conversation about that. And then I'm guessing Dr. Mike will say, and then I refer them to someone, because the alternative to that, which I don't recommend, is the physician will say, well, we've ruled out all the physical things. It could be in your mind. So here's a card, call this therapist. For a lot of patients, they're not going to do it because they feel discouraged. They feel unheard. Maybe there's a lot of stigma around therapy. And so the physician could do a lot to actually help that person with that transition.
And our medical community facilitates this because it's easy. Because if I have 15 minutes with a patient, I can't go and start talking about their childhood, but I can say, oh, well, you have arthritis, that's why your knee hurts.
Yeah.
But why did it hurt more today when you had a stressful incident with your family than it did yesterday?
Right.
So we have to be aware of this mental component, and because of our time limitations, we often don't. Because of our research funding not being put towards mental health, we don't. So
yes, 100%. Completely agree with Dr. Mike in this way. So what is he talking about right now? What he's talking about is a patient comes in, they are suffering from chronic pain, chronic joint pain or something. And because of the time constraint that the physician is under, because they have a schedule they have to keep in order to make money for the clinic or something, and because of research grants being given mainly to certain areas and not being given to mental health issues, then you have physicians that will say, oh, okay, you have neck pain, and they inject something in, or they give them a pill, or they do something, and then the pain migrates to their knees, and then they inject something there, or, he's talking about that. Instead of trying to get to the root of the problem, which Dr. Mike is proposing, is emotional issues, which I would agree as well. Not always, of course, but it can be. And this is part of our system. We have a problematic system that will catch certain problems pretty well, but will not catch other problems well at all. Someone comes in with pain that is related to stress. And he even says that, okay, fine, you have arthritis, but why would the arthritis hurt more today as it opposed to yesterday? Is it related to trauma? Is it related to stress? And so he's bringing up that idea. And we have a system that won't allow for the assessment of that or the emphasis of that or the treatment of that. And we have a lot of people suffering.
This approach, and I'm not doing anything revolutionary. I really just started having honest conversations with them to connect them to their to their thoughts, to have them understand that they may be repressing a lot. And just by opening that up, opening those floodgates, they feel a lot better.
So I don't doubt him in his account, but I don't know if he's qualified to do that. I wonder if this is why I think this is why someone sent this video to me. I think they were saying, I think Dr. Mike is great, but I think he might be talking about doing things that are not within his scope. So in the same way that I, as a therapist, cannot talk with someone about physical issues or medications, people like him, who is a DO, can generally, now I don't know his ethical codes and I don't know his training. Maybe he has special training in talking with people about repressed memories or traumas or stress or something. And certainly there's a certain amount of discussion that a physician could talk with their patient about stress or this sort of thing in a short way. But he seems to be edging into psychotherapy, which I don't know if he's qualified to do.
PTG is post-traumatic growth. It's a person who've gone through something horrible, some kind of trauma like war, like cancer, family member who had cancer, and they come out after this traumatic episode and they grow as a person. They become better. They find an outlet for their struggle. Very similar to what you're talking about with yourself. Like you said, you were going through some mental issues, and from that, you learned and you became better and you started educating people and educating yourself. That's PTG. You're an example of post-traumatic growth.
I've never heard that term.
It's not in literature. It's not something that you would find. I came up with it in my own mind, but I've also now saw other people mention it. They didn't steal it from me. I didn't steal it from them. It's a sort of a normal line of thinking, parallel thinking. So,
okay, so two things. One, I'm glad he's talking about post-traumatic growth, and it is something that is not talked about enough, and maybe I don't talk about it enough, and he described it pretty well. But he just said it's not in the literature. It is absolutely in the literature. It is in a lot of psychological literature. I think it's been around since at least the 90s, if not before that. I'm guessing there are thousands of articles and research studies discussing and examining the topic of post-traumatic growth. So I'm not sure what he just said. I'm glad he's talking about it, but it almost sounded like he said he came up with the term and other people came up with the term, or did he say it's not? Let's rewind that.
Very similar to what you're talking about with yourself. Like you said, you were going through some mental issues, and from that, you learned and you became better and you started educating people and educating yourself. That's PTG. You're an example of post-traumatic growth.
I've never heard that term.
It's not in literature. It's not something that you would find. I came up with it in my own mind, but I've also now saw other people mention it. They didn't steal it from me. I didn't steal it from them. It's a sort of a normal line of thinking, parallel thinking. So.
Okay, so Dr. Mike seems like a pretty smart fella, so I'll take his word for it. So what I think he's saying is that he came up with the term post-traumatic growth, or the idea, and then he found out other people were also talking about it, and he's claiming that there were parallel thinking. And he's also saying post-traumatic growth is not in the literature, which it absolutely is. I've been studying it for decades. So if I was there, I'd clarify with him and get more information. So I don't want to jump to any conclusions, but I'm just going to take a guess based on what he just said and say that in his travels and in his professional work, he found that there's this thing, people seem to grow after trauma. And then he started to think about it and maybe had a label for it. And then he found, other people are talking about it too. And he went into the medical literature and didn't find anything about it, but it's very much in the psychological literature. And he thinks, well, I guess I came up with an idea, but he didn't look into it that much. I don't know, though, because he seems like a smart guy, so I'm having a hard time matching what I think of him as a smart guy up with this idea that he didn't look into the psychological literature to find a term that's been around for a long time. Or I'm not understanding what he's saying.
Laughing the most, if you're going to be a doctor.
Kids.
Wrong. Any other guesses?
Adults.
Everybody.
Oh, word? Okay. Cool. I feel like when like a teacher will stump you in class.
Yeah.
And it's like that obvious answer and everybody gets really annoyed.
No, but it's true. Everyone wants to laugh. And think about it, when you're sick and you're going through a rough time, don't you want to laugh even more?
Yeah.
Because everyone, rightfully so, is being very serious and somber around you to not upset you. But then if someone comes in with a little bit of
All right, well, that does it for that episode of Psychology in Seattle. For the most part, I really enjoyed watching this video, and I really liked a lot of the things that he was saying. There's a couple things in there where I would want some clarification from him around. I suspect that if we had a conversation, it would clear things up. I don't know. But for the most part, he's talking about, hey, you can have trauma, you can have distress that can manifest physically, and if you're allowed to have emotions, and if someone hears you and you can let them out, then a lot of good things can happen. And I can absolutely give 2 thumbs up for that. Everyone out there, please take care of yourself because you deserve it. You really, really do.